My name is Cheryl Motor. I'm with Community Health Improvement Partners. We're a nonprofit here in San Diego County with the mission of advancing long-term solutions to our region's priority health needs through collaboration and community engagement. At CHIP, I oversee the obesity prevention programs, including the San Diego County Childhood Obesity Initiative, which is a decade-long now initiative focused on reducing and preventing childhood obesity through collective impact. I am very happy to be here today to help introduce and release our first ever State of Childhood Obesity report. You'll be hearing more about the contents of the report from our speakers this morning, but I just wanted to say how very grateful I am for the collaboration that went into the creation of this report. Unlike other reports of this kind, this one wasn't created behind closed doors by a select few researchers or program evaluators. COI partners were very actively engaged throughout the entire process, everything from helping to select the indicators of progress, to identifying data sources, to actually conducting data collection and analysis. This was truly a demonstration of collective impact in action. I'd like to thank the many partners who participated in the development of this report, as well as all of you who came today to support our efforts, and I hope that you are all as proud of our work as I am. You should have all received a copy of the report, as well as this dashboard document. This is actually, we did print out some copies for today, but this is an online publication, and there's a link to the online version of the report at the back here of this dashboard document. So let's move on. I'm very happy, as always, to introduce our first speaker today. Supervisor Ron Roberts has been a champion for children's health for well over a decade now. He recognized in a way that was very early on at the time in the mid-2000s the potential impact childhood obesity could have on our region. And he challenged us to create a comprehensive countywide plan of action to address the problem. His vision spearheaded our work that we're all here to talk about today, and he continues to be one of our biggest supporters. So please help me welcome Supervisor Ron Roberts.
Thank you, Cheryl. Wow. First of all, it's good to see all of you here this morning. Cheryl might remember when we first started, we didn't know if anybody was tuned into this issue. And we were looking at some of the numbers that we saw here in San Diego County, and we decided, let's call a meeting. And that first meeting, it was about 90 different community partners that showed up. And we were absolutely, totally surprised that that number of people were tuned in. This is before anybody on a national level had recognized this issue. I mean, subsequently that, we've seen this focused on the cover of national magazines and other things, but this is way, way before that. And the turnout was pretty fantastic. We thought, okay, now we got to do something. We've got everybody that realizes there is a problem. That first group was called
Coalition on Children.
Say it again.
Coalition
on Children and It was a terrible name. I mean, it was, and so we changed and we decided, okay, we're going to bring everybody together. We need to do a plan. We need to do a countywide plan. We need to start to aggressively not only want to do something, we needed to plan ahead. We needed to understand the issue. We needed to engage others, and especially the school districts. I have a favorite story of one of the school districts. I attended one of their board meetings to encourage them to, let's serve healthier food to the kids. And they blew me off completely. They go, oh, you want to close down all our soda machines? I said, no, why don't we just introduce maybe a choice that's healthy instead of all of this stuff? No healthy choices. It was all sugared stuff. And it just, anyway, they blew me off. So I thought, I'm going to go back. And what did I do? I thought, nobody's paying attention. So I got a guy who dressed up in a banana costume. It was the best banana costume you ever seen. Big banana. And of course, when you do that, who's going to be there? The press is going to be there. And who will the school board listen to? Not me, but the cameras are on. So all of a sudden then we had a revolution going on. And fortunately about that same time, there was a guy who had worked in one of the hotels that took over in charge of food services. And he got it right away. And he's absolutely been wonderful over the years, but he introduced salad bars and all kinds of things. I just say this because the environment when we started, now we're having a national conference. I mean, we couldn't have had a national conference if our lives depended on it when we started, because it wasn't, nobody was elevating this on the radar screen. So somewhat more than 10 years ago, former supervisor and I, well, let me make sure I get the right former supervisor, Supervisor Pam Slater, and Pam Slater-Price decided let me partner with you on this, and let's see what we can do. And the Childhood Obesity Action Plan was first published in 2006. And this was kind of our keystone document when we started out. And it called on individuals from multiple sectors to all work together. Let's work together on this issue. And the San Diego County Childhood Obesity Initiative, that we affectionately refer to as COI, that was formed at this time. The primary partner of that effort was our Community Health Improvement Partners, CHIP. And without a doubt, the leader from that time on has been Cheryl Motor, who's here with us today. She's been fantastic, I will tell you that. So a decade in, we've engaged not just tens, but now hundreds of partners. And we've worked tirelessly across many different areas in this county, including government, including healthcare organizations, including schools and after-school programs, including early childhood programs, and the public, the communities, and media and business. We haven't missed hardly anybody that would listen to us and talk about this. So working together, we put strategies in place that are designed to support healthy eating as well as active living for San Diego's children and in fact their families. These are things we've worked hard to do. Now today, for the first time, we have a definitive State of the Childhood Obesity report. And it's developed with the input and the support of many different partners. And nobody's doing this alone. And the reason why I think we're seeing success in moving forward with this is that not just are people interested, they're willing to participate in every way. So this first ever report card presents childhood obesity data as well as the baseline measures that will give us indicators of progress. And this is important. When we first started out and we were working with the school districts, now we weren't, I can't say districts plural, I think it was one. And we wanted to have some baseline. We wanted, okay, what's going on here? And we had to work through a whole lot of privacy issues. We didn't want to know about one individual child. We want to aggregate things. We want to know where are we. But even with that, it was not an easy, let's just slide through. Well, this report shows that the percentage of San Diego children who are overweight or obese, it's leveled off. Okay, that's the good news. It's leveled off. And in some cases, in some populations, it's even declined. But there's also some tough news here in the report. In our best performing school districts, underscore that, our best, 15% of the children are overweight or obese. That's the best, and that's unacceptable. In our worst, the number climbs to 50%. And that is totally unacceptable. Of the county's 18 cities, 16 have policies in place to promote physical activities, that's good. I'm not going to tell you who the two are, but we're going to get them going. And we have some areas, we've got some holes in what some of the ones that are participating are doing. And that's part of what we do, is try to inform people and let them know, here are the best practices. You can be doing this. You can be helping. So most of the unincorporated communities have have some holes in their program, and that's the county. Those aren't incorporated cities. And although I would be remiss if I didn't recognize Fallbrook and Alpine and Lakeside. They've done really good jobs in those areas. They've checked off the boxes. They're doing a good job. The report also outlines projects and activities where the COI and our partners are at the forefront of creating innovative policies and practices. One area where we've had great success is our Farm to School program. And this has really been a good program, and it was a vision of let's get the fresh food, fruits and vegetables and healthy foods out to the kids. It was designed to get our school kids eating more local, healthy, seasonal foods, and to better understand the food that they were eating, to understand food, instead of just gobbling it down like I do. I'm proud to say that 33 out of our 42 school districts now have such policies in place. And that's remarkable. Anybody that's worked with school districts will appreciate that, I can tell you. And it's really thanks to the COI initiative and the people that are in groups that are involved there that this has happened. These work groups have served as many think and do tanks tasked with developing, engaging, and replicating the best practices and resources. And other innovations have emerged from these work groups, including the Wellness Champion Program. And this is in partnership with the YMCA and the Child Care Resource Service, which helps licensed child care providers improve nutrition and physical activity, an important segment of our population that sometimes we don't see. And also the Clinician Community Integration for Well-Being. Another bad title, but that's a pilot program to connect families who have been identified as overweight or obese with trained health coaches and community resources. This is focusing in now on individuals and see how we can help them to change. The disparities in obesity rates among ethnic and low-income communities that our report card reveal are not unique to San Diego. We're seeing the same inequities in children's health playing out on the national level, same sort of pattern. So it's fitting that the National Childhood Obesity Conference, which is taking place in this hotel, and is focused this year on the issue of health equity. Extremely important. It's important that we share success stories and programs that work. Going forward, San Diego's State of Childhood Obesity Report will provide a very valuable benchmark, as I mentioned earlier, for measuring progress. And I review the results as a call to action for our schools, for our government officials, and for healthcare to take notice and to contribute to making a difference. This is what's critical. We all have a role to play because we all have a stake in the future of better health for the children in San Diego. So I'm very thankful that you're here with us today. We're going to make a difference. Thank you.
Thank you, Supervisor Roberts. Our next speaker is a longtime member of the Childhood Obesity Initiative's Leadership Council and also participates in the COI's healthcare domain, where we call on him frequently for his expertise as a public health expert, as a clinician, pediatrician, and breastfeeding advocate and champion. I'm pleased to introduce the child medical officer for the County of San Diego's Health and Human Services Agency, Dr. Dean Seidlinger.
Thank you very much, Cheryl, and thank you to Supervisor Roberts for your continued leadership and support of this effort. We couldn't be making the changes we do across the region without your help. So I'm really happy to be here on behalf of the Health and Human Services Agency. We're a proud partner of the San Diego County Childhood Obesity Initiative, and we're committed to supporting the health of children and their families across our communities. As Supervisor Roberts mentioned, over the last several decades, we've seen an alarming rise in the rates of overweight and obesity amongst children. San Diego has not been spared from this epidemic. As a pediatrician, we see conditions that we never saw in childhood before, like diabetes, fatty liver disease, high blood pressure, high cholesterol. These diseases are brought on in childhood by the obesity epidemic. In addition, we know that these children who are overweight or obese are much more likely to become overweight or obese adults and be subject to a lifelong risk of chronic conditions that their healthy weight peers are not subject to. So it's very exciting that for the first time locally, we brought together data on younger children and school-age children to see how we're doing in our fight against childhood obesity. The data comes from the California Department of Education from their 2014-15 FitnessGram data, as well as from our special supplemental nutrition program for women, infants, and children, commonly known as WIC, which we looked at the weight status of 2 to 5-year-olds who receive benefits. As you'll see from this report, our California students in 5th, 7th, and 9th grades, about 1 in 3 students in San Diego County are overweight or obese. So 1 in 3 students. These are kids who are enrolled in public schools. Slightly more of those children are overweight than obese, but it's alarming nonetheless to see this number. And while these rates have leveled off or even declined in the past decade, we continue to see disparities across students, and these are unacceptable for us in our community. In that same school year, the rate of obesity in Hispanic students was 1 in 4. That means 1 in 4, 25% of Hispanic students were obese, compared to just over 1 in 10 of our non-Hispanic students. So that disparity is quite alarming. We also see similar results when we look at economic status of the children, with our poorer students being much more severely affected by obesity, with 1 in 4 students, which is over twice the rate of those who are not economically disadvantaged. These numbers become even more important when we realize that almost half of the students enrolled in public school here in San Diego County are Hispanic, and about half the students are also socioeconomically disadvantaged. So this isn't a small subset of students that we're talking about, this is quite a large subset. We see similar numbers when we look at our younger children, those 2 to 5 who are receiving WIC. When we look at those children, nearly 1 in 3 were overweight or obese. And Hispanic children had much higher rates of overweight and obesity than their non-Hispanic children, 1 in 3 children in this youngest age group being overweight or obese, compared to their non-Hispanic peers, where it was 1 in 4. And again, this is important because this is not a small subset of children we're talking about, but nearly 3/4 of the children and families who are enrolled in WIC are Hispanic. So these data highlighted in the State of the Childhood Obesity Report really give us that call to action to continue to look for equitable resources in all our communities where everyone has access to physical activity, safe places to play and exercise, healthy food. We recognize that addressing significant public health issues of obesity require changes in the environment so that all individuals in every neighborhood and community have access to healthy resources for their children so that we don't condemn them to a lifetime of chronic diseases. And this report really provides us a roadmap as we go forward to ensure that all children are healthy, safe, and thriving, which is what parents want, which is what we in public health want, and what I think everyone in the community wants as well. Thank you.
Thank you, Dean. Our next speaker is a physician champion who literally practices what she preaches. In her work as a pediatrician, she understands the challenges faced by the families in her care who are striving to be healthy. She, in addition to her medical practice, she serves as a senior advisor to the American Council on Exercise, volunteers her time with numerous national committees on obesity, and also, I'm happy to say, serves as the co-chair of the Childhood Obesity Initiative's Leadership Council. Please help me welcome Dr. Natalie Muth.
Thank you, Cheryl, and thank you everyone for being here today. I can't tell you how glad I am to be here as both a co-chair of our Leadership Council for the Childhood Obesity Initiative, as well as a practicing pediatrician. It's really a privilege to be here on the launch of our State of Childhood Obesity Report. and share with you some information of what we've learned over the past 10 years since the Childhood Obesity Initiative has been in place. Number one is that when we work together across sectors with a shared mission and vision, we are able to achieve more. And as you'll see from the report today, we've had a lot of success in addressing childhood obesity through the multi-sector collaborative effort across the county. But also, as a practicing pediatrician, I've had the opportunity to see children firsthand in the office and in the clinic and better understand the trials and tribulations that our children and our families are facing. No matter how often we tell parents to have their kids eat better and be more active, if their communities where they live, work, play, learn, pray, don't support them in being able to be active, we cannot make any progress and we will not have success. So one thing that is abundantly clear is that communities and the environments in which our children grow up and live is as critical as any motivation that a family might have to eat better and move more. And that's been a huge priority of us in the county and through the Childhood Obesity Initiative. So a few things that I'd like to highlight is some of what we've learned in looking at those environmental changes that have been implemented and what you'll see when you're looking through the State of Childhood Obesity report. So 16 of our 18 cities in the county have adopted policies that support active transportation, biking, walking to work, to school. By having policies that support this and being able to integrate physical activity into daily life, we make a lot of progress on helping our children to be healthier and to be more active. 33 of our county's 42 school districts have made significant strides in offering children produce that's been locally grown. Not only do our kids eat better and get exposure to more delicious and tasty and locally grown produce when this happens, but also we're able to support our local agriculture and our local business community. Additionally, 9 of our local hospitals over the past several years have adopted policies where they have increased access to healthy foods and beverages for their patients, staff, families, visitors, and the general public. When our hospitals practice what they preach, we make progress in helping our families to be able to eat better. And finally, nearly half of licensed family child care facilities in the community and in our county have adopted national nutrition standards for the food that they offer to the children in their care, so that we can be sure when we send our children off to someone else to care for them, they are still being able to get access to healthy nutrition, as well as when they're at home and having more access to healthy nutrition when they're under the care of their family. But while these are successes, and while we should celebrate the progress that we've made in policies and across the county, we still have work to do, and there's 2 areas in particular where I would advocate that we focus some of our attention. One is that only 7 out of the 42 school districts in our county have adopted strong wellness policies that support physical activity. And only 10 districts have policies that require physical activity in before and after school programs. We know that kids who are active not only are healthier, but they're able to pay better attention and perform better in school. We really need to do more to have opportunities for our kids to move throughout the day and not just rely on activity outside of the school day. Additionally, only 5 of our county's 18 cities and only 3 of our county's 42 school districts have strong healthy beverage policies. This is particularly alarming and of concern because we know that sugar-loaded beverages like sodas and other drinks that have abundance of sugar and calories in them are a major source of calories for our kids, non-nutritive calories, no nutritional benefit, and a leading reason why we even have a childhood obesity epidemic in the first place. If we make more efforts to reduce added sugars in the beverages that our children drink, we'll make more progress in helping to prevent and treat childhood obesity. And this really gives our communities and our schools an opportunity to make a significant impact by looking at their policies and strengthening them to reduce the added sugars in our children's drinks and throughout the day. What it comes down to is that all children, regardless of where they're born, where they grow up, who their parents are, what insurance they have, how much money their family makes, all children have a right to be healthy. And we need to make this a high priority and be sure that we're looking at community efforts and environmental efforts to help children to have a right to be healthy. As a pediatrician with Children's Primary Care Medical Group, where we see children across the spectrum and throughout the county, I see every day children who are impacted by obesity and the consequences that come from that, including prediabetes and diabetes and some of the other health diseases that Dr. Seilinger discussed. When we make changes on a population level and help our communities to be healthier, it helps make it easier for families to translate a recommendation that I might make in the office to please increase physical activity and eat more fruits and vegetables to something that families can actually do. And I'm really proud to be a part of the Childhood Obesity Initiative, where a lot of the policies that have taken place over the past 10 years under the leadership of the people here and out in the community and all of the sectors that have worked together to make a lot of progress. And I hope that over the next 10 years, we're able to continue to do so and use the State of Childhood Obesity Report as a roadmap to help us to be successful in the healthiest county in the nation. Thank you.
Thank you, Natalie. Our final speaker today provides for us a very important voice, and that is the voice of youth leadership. Miguel Molina is a junior at Kearney High School here in San Diego. He serves as a member of the UCSD Youth Advisory Council, which is a group of young people dedicated to improving the quality of life for themselves and their fellow community residents. We are very grateful that Miguel is here today to share his experience and his perspectives. Miguel?
Thank you. As she said, my name is Miguel Angel Molina. I am part of the UCSD Youth Advisory Council, and I'm a junior at Kearney High School. I live in Valencia Park, a small economically disadvantaged community in the southeastern part of the city of San Diego. I'm a Hispanic youth with a strong Mexican heritage. As a high school student, I see chocolate milk in the school cafeteria. When walking into the school cafeteria, students are given two options: chocolate milk and plain white milk. No one chooses the plain white milk. I have had several conversations with my peers, and we've come to the conclusion that if the school were to offer water instead of chocolate milk, then many students, including myself, would choose water instead of chocolate milk. If water bottles were an option, students would reduce their daily sugar intake. The report clearly illustrates that school districts like mine have a majority of economically disadvantaged students, have a much higher rate of obesity and overweight students compared to school districts like Coronado and Rancho Santa Fe, which have an overwhelmingly healthy population. According to this report, only 3 out of 42 school districts in San Diego have strong school district beverage policies. This is a significantly low number of school districts. And guess what school districts those are? The wealthy school districts. In addition, Hispanic students approximately represent half of all public students in San Diego. This report tells us that 22.8% of white students are overweight or obese, as opposed to the 43.3% of Hispanic students. I did not need a report to know this. Based on my life and the comparisons I have made with the wealthy community and my own, I could have predicted these statistics accurately. As a person that lives in the economically disadvantaged community of Valencia Park, it has been difficult to stay healthy. At every corner of my neighborhood, there is some sort of fast food restaurant. Since these fast food restaurants offer inexpensive food, many of my friends and many of the residents tend to buy from there. Why waste $5 on a salad when you can buy a burger for $1? It is not easy for me and my community to buy healthy food. We simply cannot afford it. As a person that lives in Valencia Park, there are streets that have cracked sidewalks and streets that do not have a sidewalk at all. How can you exercise if the streets and the parks are not safe? How can you ride a bike in the bumpy roads with holes in them? How can you play in a park that's not safe? How can you play in the park if the grass is dead and the playgrounds are old and in disrepair? You simply can't. I'm not a number. I'm Miguel. This is my community. This is my life. This is what I live through on a daily basis. As a young person, I request investments in safe recreational spaces for my community and communities like mine, because in Coronado and Pennsylvania, those exist. Investments in recreational spaces